Over to you, Dr. Christine.
Thank you so much for having me again. As Abuna said, we're going to be talking about older kids today that have a lot going on. So hopefully that you'll be able to see that, because sometimes adolescents, they have a bad reputation of being, difficult to deal with and challenging and all of those things. And hopefully today I can give you a little bit of understanding of maybe what is the process of what's going on in their minds, and why they act the way that they act. And hopefully we can understand them a little bit better. There's going to be a lot in this presentation. I'm kind of giving you a heads up on that first. There's going to be a lot going on in this presentation because there is so much going on in adolescence, and we'll also touch on adult children towards the end. So and this is my contact information. You can reach out to me this way if you need to, after this presentation is over, through my website or through my email, which is listed there. And so again, last time we had talked a lot about our younger children all the way up to tweens, which is all the way up to age 14 or so. So we learned a lot about their biology and their makeup, and trying to understand our kids from a biopsychosocial and spiritual perspective, and not just take their behaviors as behaviors. The biggest thing I would caution with adolescents is that they look much older. They look like they're adults, but they're not going to necessarily act like adults. Their brains are still very much developing. And so for that reason, these are not young kids anymore, but they're not adults either. But they have a lot going on. And so hopefully I'll give you a little window into what's happening in these adolescents and into adulthood as we move through today's presentation. I'll talk about all of the difficulties and the challenges that they're going through, how to strengthen your communication with them, and things like cyber addiction and bullying are going to be key and to highlight in this group. And then setting the foundation for resilience, which we will talk about much more extensively next time. Also next time, we will be talking a lot about your parenting style, and then how that can affect how you parent your children and how that can affect your relationship with them. But in this session, I wanted to set the stage again with a little bit older children into adulthood, and all of the challenges and difficulties they may be facing, either biologically, psychologically, socially, morally, and even spiritually. So today we're going to be talking about kids 15 and older. If you remember, like I said last time, we had talked a lot about, young children all the way to age 14. Today, we're going to be talking about 15 plus. Basically, I'm going to be discussing the developmental stages of adolescence, the challenges that they're facing, how we can identify patterns within those challenges. And all of this is really to set up the stage for what is positive, resilient parenting, and how to become more resilient spiritually and psychologically through our parenting and through our service, through our grandparenting, and anytime you interact with a child that is this age, younger or older. So obviously last time we had talked about that we all go through adversity. Adversity is a part of life. Sometimes we feel like we're carrying the weight of the world on our shoulders. This is even more pronounced in adolescents because, again, they are still growing, still learning how to develop coping skills. They haven't learned all the coping skills, and they have a lot going on at the same time. And then you throw things into the mix like COVID or familial issues or financial issues or the parents' marital issues. And that creates an even more intense situation for these adolescents in this very confusing and puzzling time. We talked a little bit about last time. This is just kind of to review the next few slides, is to review what we talked about last time, that anytime there is a stress, that is any demand that is placed on us, on our body in any way, and we can either adjust to that or maladjust to that. So act either appropriately to the stressor or not act appropriately to the stressor. And again, with adolescents, they have a lot going on. So, the world and their parents are kind of pushing them to find a job, to do well in school, to make friends, to prepare for college, to prepare for adulthood. So there's a lot going on in this age in particular. They're carrying a lot on their shoulders. And we talked about this graph a little bit last time, that we need to stay in the green or the yellow aspects of stress. This is healthy stress that can actually motivate us and keep us focused. Think about if you have a promotion coming up or a meeting that you have to prepare for. A little bit of stress is healthy because it'll keep you aware of what you need to do, excuse me, how to stay focused on that task, how to stay motivated, how to stay healthy. However, if your stress is overwhelming your coping responses, you're going to get fatigued, panicked, anxious, burned out, overloaded with stress, and even physically or mentally ill. And we don't want our adolescents to get into that category, of course, especially because they're dealing with so much, even if they appear like they're not dealing with so much. So what are some of the things that cause stress? In general, it could be being overworked. It could be financial issues. It could be things simply like traffic. Yesterday, for example, my internet went down for a few hours and I wasn't able to work. That was stressful. Could be relationship issues and arguments with your family. So everyday things can relate to stressors. But mostly for adolescents, they are either overly worked, very ambitious with their schedule. They're involving sports, they're involving schoolwork, social activities, jobs. Their first jobs may start at this time. They have to balance school. They may be running late, financial issues absorbed from their parents, too many responsibilities, not enough free time, like I said, traffic or technology. So they're generally not spending enough alone time or time with God. They're not spending enough time with support networks. They actually do need some time to relax or have a vacation to calm themselves down from everything that is going on. If the parents are having marital difficulties or financial issues, like I said, that can trickle down to these kids. They may also have a lot of misunderstandings with their parents who may see them a particular way. Like I said, the reputation sometimes of adolescents is that they're difficult or hard to deal with or challenging. And so this may create some tension as well. Again, I showed this slide last time as well. These are some of the main issues that adolescents are dealing with. I'm going to cover a lot of these today. So you will have access to this obviously in the presentation later because there's a lot to cover here. But these are basically the stressors that adolescents usually face. And so we're going to cover most of these, but the rest of them are still things that they face, even if we don't cover all of them. So again, you may see in your adolescent physical, feeling, behavioral, or thinking signs of stress that look kind of like this. And if you see these, this is something to pay attention to. If they're very negative and indecisive, if they're losing their appetite, if they're sleeping too much or too little, if they're having physical issues, usually that comes in the form of GI issues, stomach issues, headaches, skin irritations, things like that. All of these things can create distorted messages in their mind, saying that they're unwanted or they're shameful or they're broken. They're inadequate in some way and that nobody can really help them. They may show you on the outside that everything is fine, everything is going well, and on the inside they may be feeling really down and discouraged and in a lot of pain and problems. And so we want to take all of these things seriously and understand that this could be related to sin, but it's not necessarily a sin if they're feeling down. It's not necessarily a lack of faith. It just could be that they're struggling. It's not a weakness. It's not necessarily a separation from God. And it's not just something that they can snap out of. These can be genuine medical or psychological conditions. And I'll talk more about that shortly, but it's important that you know, and to be supportive is to, again, look at it from a biopsychosocial and spiritual perspective, and not just to automatically call it one of these things, because that can injure that child even more. And that may create even more problems in them. Okay, so again, we said this last time as well. Along the mental health spectrum, we see people across the spectrum, all the way from people that are healthy and just need some support and encouragement to people that are doing really unwell and need a lot of support. So it's never too late or too early to get help. You can always get help to support your adolescent and yourself as you're dealing with this struggle and this change in behaviors and all of these things. So now let's start talking about adolescence more specifically. This is a time period where there is a lot of stuff happening mentally, psychologically, socially, morally, and spiritually. And again, if you add into it the pandemic or any other family struggles, you're going to get an adolescent who's even more struggling and more confused and more dealing with issues. This is a time period where there's a lot of identity confusion. They are getting different messages from home, from church, from school, from the media, from social media about who they should be and what they should be. And so they may be a little bit confused about what they're supposed to do with their lives and who they are and what their place is in the world. Additionally, there's a lot of changes occurring. Here in the States, around age 14, when the tweens are ending and this adolescent period is starting, they're starting high school. They're separating even more from their parents. They're starting to think about college, going off on their own, what their career choices is going to be. A lot of changes happening in those 4 high school years. And eventually, at the end of those 4 high school years, they are adults. So they started off technically as kids and they ended as adults. So there's a lot of change that is occurring in this time period as well. And as a result, they may want to explore a lot because exploration is going to help them to figure out their identity. Some of this exploration may be safe and some of it may not be so safe. Like, for example, with cyber addictions and where they're going online. So be aware of these explorations because, again, there's a lot going on in this time period. G. Stanley Hall, which was one of the first psychologists in the US, I believe he was the first American Psychological Association president, said that this period is a period of storm and stress. Think of any storm that comes through an area. It may clear its path. It may be a lot of destruction, a lot of pain, a lot of agony in the time of that storm, and therefore it creates a lot of stress. He said in this time period, more than any other, there may be conflict with parents while they're trying to be more independent. This may be they may have a lot of mood issues as a result of biological changes, and they may be involved in a lot of risky behavior in an attempt to fit in with their peers. Obviously, this is going to differ from family to family and child to child. Not every person is going to experience this in the same intensity, and it may also depend on culture. But if it is experienced, it may be experienced more than ever before in this time period. It may be long-term, it may be transient. So it may be for 6 months or a year, or maybe much longer for the entire duration of their adolescence. But it is more likely to happen in this time period than any other. Another psychologist who talked a lot about developmental stages described this period as an identity crisis. And this word was initially used to describe those who came back from combat and they didn't know where they fit in, where to go get jobs, where to fit in back in society after a war. And so the same term was used for adolescents because of all of the turmoil that is happening because of biological, cognitive, social, and moral development. And this is a very rapid speed of growth, almost as quick as what you see from infants to toddlers. And this is a time period where they're kind of oscillating between what can I do for myself and what should I have my parents do for me? I want to be independent, but I also want to depend on my parents. So there's a lot of, again, turmoil that is occurring. We know that puberty starts as young as 8, but the average age for girls is around 11. For boys, it's around 13. There's a lot of growth and development occurring here, especially in the frontal lobe of the brain that is not fully developed until age mid-20. And so if you see them as looking like adults, they're starting to have features of adults, but they're impulsive or they're moody or they're angry all the time. It could be because of hormonal changes and this constant questioning of who am I and where do I belong. There's also a lot of, in these years, there's a lot of self-focus. It feels almost like there's a spotlight on them. Everybody's paying attention to me all the time. There's a lot of embarrassment that's going on. Mom and dad shouldn't hug me in public or talk to me in public because it's embarrassing. But they're also starting to think about more complex issues. They're asking much more questions, hypothetical questions. They're starting to think more about inconsistencies and hypocrisy, and they can pick up on things that you're doing that are hypocritical that you're asking them to do. And this can lead to a lot of heated discussions. So be aware of that and to take this calmly and patiently and not to stress yourself out in the process either. Socially, they're trying to form an identity. They're starting to separate more and more from mom and dad and clinging more and more to their peer group. This process starts as young as kindergarten, as young as age 5, but definitely is more pronounced by high school. In their peer group, they may feel they're either in the in crowd or part of the out crowd, and that may create a lot of pains and sufferings as well if they're part of the out crowd. They may also be worried about how to problem solve or what am I good at? They don't want to feel inferior. Who am I as an individual? What do I want to do with my life? What values do I live by? Do I believe in what my parents believe on? And they almost try on these different masks until they find the one that fits them. but this is a process and it takes a long time. So they're searching for identity. There's a lot of changes physically in their body. They see themselves as differently. They think others see them as differently. They're confused. And again, they're confused between the desire to be left alone, but at the same time to be accepted and understood by their parents, by their peers, by their teachers, by their servants, etc. And then there's morality development. We think that they should automatically know right from wrong, right? You've been teaching them as your parents and servants all of this time up until age 15 plus, so they should automatically know right from wrong. Well, a person named Kohlberg came up with a morality development for children and said that before age 9, it is a self-serving morality, and all they care about is they don't want to be punished or they want to gain a reward. So anytime they're doing something good, it's because they want to gain a reward and they want to avoid punishment. As they begin in early adolescence, then it's because they want to uphold society's rules. And again, they want to follow what the rules of the school are, their parents, society. They don't want to get in trouble that way either. But by the time they're late adolescence, so a little bit later than the start of this adolescent period, so 19, 20, 22, 23, that is when they're thinking more thoughtfully and considerate of others, and they have more ethical principles. So again, their brain is still developing until age 25, 26. They're not going to have all of this thoughtful, considerate attitude until at least they're in their mid-20s. Yes, they should generally know right from wrong, but their morality is still developing all the way till adulthood. Okay, so again, be patient with your children. Struggles happen for kids when they're expected to be perfect. If they get a, in the States, it's, an A, that's one of the highest grades, is like a 90 or 92 plus. So if they get a 92 plus and the parents are saying, why didn't you get 100 on this? Why didn't you get an A plus plus plus? Why aren't you like your cousin so-and-so? And they want them to be perfect. This creates mental health issues. If the parents are so overprotective, last time we talked about roots and wings. So you're instilling the roots, but not giving them any wings, that'll create mental health issues as well. If your parenting is inconsistent, sometimes you're, loving and kind, and other times you're really rough with them, that creates problems as well. If you're not modeling things as well, if you're not giving, physically supporting them and helping them, or if there's something due to their faulty thinking, because again, their brain is still developing, all these can create psychological issues with time. When struggles happen, you can tell by, again, those biological thinking, feeling kinds of issues, but you'll notice that kids will sometimes hold their feelings in, which is a big red flag that there's something wrong. They may act out in terms of displacing their anger at something else, or regressing and returning back to a younger age, maybe talking differently or something like that. Their self-esteem may suffer. They may increase in depression, anxiety, or sadness. And they may need help working through a problem. They may feel confused or guilt or shame, anxiety, depression. They may feel that no one understands me. And these are all typical feelings, again, with teenagers, but especially if they're struggling with something. While acting out is not good, it is a much better thing than if somebody's holding in their feelings, because that feelings that they're holding in has to come out somehow. So some people may self-harm. They may have suicidal ideations. They may not talk to anyone and then just carry that burden of depression along with them. All of those clearly are not healthy. What is your job as a parent or a servant or a grandparent? To understand your kid's unique personality, that they have both strengths and weaknesses. Don't just focus on the weaknesses. Don't clump them in with their siblings. They have their own personality and they have their own areas of interest. Have a relationship with your child that is filled with unconditional love. And sometimes parents confuse this unconditional love that means I accept everything that they're doing and there's no consequences. That's not true. It just means that you're going to love them through the problem and help them work through it. And if you get overwhelmed yourself, ask for help. Again, it takes a village to help a child. It's shown that adolescents that are in a secure relationship with their parents and have a consistent relationship with people in their lives tend to be more secure, self-confident, good body image, good relationships with peers and adults, are able to reason better and make good decisions as they grow and as they become adults themselves. So have a good, solid foundation relationship with your kids. Yes, there are consequences. Yes, there are rules, and we'll talk more about that with parenting style next time, but you have to love your kids through those issues. Additionally, like I said, their brains are still developing. They look like adults, they really do. But these are what science tells us are still developing in their brain. Their attention, their memory, their processing speed, and their organization are still developing. So if you've told them 5,000 times to clean their room, this is the reason why. I'm not saying it's an excuse, but this is an explanation of why you repeat yourself over and over again, why they struggle with things. This stuff is still developing. So when these adolescents are taking risks, again, you need to put boundaries on it, but help them to identify all of the possible choices if they go along with this risky behavior. Then identify all the consequences for each of the behaviors, evaluate which one is reasonable to do, evaluate the consequences, and then make a decision. All right. Remember that adolescents feel like they're invincible. Nothing is going to happen to me if I go to this party. It's not going to be broken up by the police. There's not going to be drinking. They think they're invincible. So we have to tell them about all of the different possible consequences, and then remember that their brains are still developing. Help them come up with a desirable choice, a way out of that situation, and then help them to make the decision and follow through. Also explain to them that it is that their self-esteem and their appearance may suffer because they're going through many biological changes, to not compare themselves to others, that they may feel that there's a spotlight on them. They may feel like they're being criticized by everybody, that they can't keep up with the media or social media standards, but their appearance is not everything. There's so much more to their character than, sometimes some of the things that they see about themselves physically. So talk openly with them about these things and have a conversation with them about what they may be feeling and what to expect. Self-esteem may suffer because of their academics, because of their relationships with the same gender or opposite gender, from disappointment, and from relationships, their body, their mind, their environment. All these can create self-esteem issues. So they may start with a low self-esteem. You can start anywhere in this cycle, but it's a cycle that is vicious and continues unless you break it in some point. So they may start with negative thoughts, let's say. These negative thoughts create a lot of anxiety and thus poor performance in school or in sports or in anything else. That poor performance and anxiety leads them to fail. Then they blame themselves for failing. When they blame themselves, that creates more self-esteem problems. And then the negative thoughts start again, and on and on and on this cycle starts. So at any point that you see any one of these, you have to infuse them with more strengths and help them to build their self-esteem by what they're actually good at, and to zoom out and to see the whole picture, not just part of the picture and part of what they failed at. So if they failed a math test, that doesn't mean that they're terrible at everything. They just don't understand this unit of math. So let's get some tutoring. Let's put things back into perspective, and let's reframe the negative thoughts. All right. In order to build self-esteem, you also have to recognize when they're talking low about themselves, and again, reframe it into something positive. Make sure they're taking care of themselves, eating healthy, sleeping enough. Remember that it's about the journey, not just this one incident that didn't turn out well. What can you learn from those mistakes that you've made? How can you do more meaningful things? Create SMART goals, which I'll talk about shortly, and include some time by yourself with your parents to help you problem solve, and with God every single day to help you to understand what you need to do from here. So a failure in a small thing is supposed to be a learning experience, not something to demolish your personality or your self-esteem or things like that. So learn from it and move on. That's what's really key. SMART goals are goals that are very specific. Okay, I'm going to bring my math up grade from a 70 to an 80 in this quarter. That's also something that is measurable. And so I'm not just saying that I'm not smart in everything. I'm just specifically focusing on math. I'm making my goal measurable to get my grade from 70 to 80. What am I going to do to get my grade from 70 to 80? Maybe I'm going to talk to a tutor. Maybe I'm going to get some extra help from my parents or my teacher. Maybe I'm going to study an hour extra every night. That is an actionable response. The R stands for realistic. You're not going to jump from a grade of 70 to 150. You're just going to jump from 70 to 80. Because if you try to double your score, you may be discouraged if you don't get to that, and then your self-esteem problems may get even worse. So make sure your goals are realistic. 70 to 80 or 85 or even 90, is reasonable. Beyond that may be a little bit difficult. And it has to be time bound. All right. So in this quarter or by the next test, I'm going to jump my grade from a 70 to an 80. And so that gives you a time limit by which you're going to study what you need to study and assess your progress, and then create these goals again and again. So SMART goals are really, really helpful because they're very structured and narrow in focus, not I'm going to fix the entire world by the end of next quarter. And also when they have feelings of inferiority, again, with teens, they have a big paintbrush they paint everything with. So if I'm bad at math, I'm bad at everything. I'm bad in my family. I'm a bad person. I don't know how to do well in sports. I'm a bad daughter. I'm a bad son. It's very global. So we want to modify their standards and to make reachable goals, help them to look at things more thoroughly, but also localize their feelings of inferiority. Is it your body image? Is it your grades? Is it socially? And then explore ways to lift self-esteem and have greater self-worth as well. So these are all kinds of skills that you can use to help with your adolescence. And take it step by step. They want to jump to this top step without taking all of the steps below it. So if they're getting a 70% in their math, how do I get to 71%, 72%, 75%, and then to 80? Take it step by step, day by day, hour by hour, and you will get to that, to get to the top of those stairs. Another thing that they struggle with is body image. Society puts a lot of pressure on them. They may get bullies, which I'll talk about shortly. You also have to explain to them that beauty is not just about the facial or the body itself. It's about the whole personality. And so how can we reframe about what our strengths are and avoid talking negatively in front of them about your own body image? Make sure that you have enough self-care, again, that they're eating healthy and sleeping and doing the things that they need to do to keep their physical body healthy, but celebrate all of the strengths that their body and their mind has together. So maybe they like to swim, or maybe they like to play a particular sport, or they like to go for a walk. Highlight those things, not just what the negative social media or what they're comparing themselves to is saying. There's also a lot of academic pressures. Over 70% of students have felt some sort of stress by their schoolwork. And some of them worry about over 50% worry about their grades, their tests, and college acceptances later on. And this is also a cycle that can create a lot of problems. Pressure builds, so they want to be brilliant. Then they get anxious because they're not as brilliant as they want to be. They tell themselves that they're less than, that they're inadequate, that they must work harder. That creates a lot of burnout. They fail, and on that vicious cycle goes. And as they get older, they're getting more and more independent. They're not going to be spoon-fed information like they were when they were in first and second and third grade. There's a new way for learning. There's more work than middle school. They have to work independently. They have to prepare for college. So you have to teach them to ask for help, that when they repeat is when they actually master. They're not going to get it from the first try, and that's okay. Also tell them to make time to pursue what is meaningful. Don't put aside your hobbies and interests because you're working to study hard. Balance is the key. So that helps to decrease the burnout and all of the pressure. You also have to focus parents on 7 modes of intelligence. There's 7 kinds of intelligence. It's not just math and science, but some kids are better at these things more than others. Some kids are very movement oriented. They're good at sports. Some are good at self-reflection. Some are musical. Some are good at relationships. Some are good at verbal and math and spatial. Others are good at emotional intelligence. They know their emotions. They know exactly what they're feeling, and they can recognize it in others. And this helps them to achieve their goals. So again, if you're only focusing on math and science, you yourself are missing a whole other part to these kids. And they're not living to their full potential because those things are being ignored. Help them to manage their academic stressors by using the self-care challenge. These are all great things that they can do. Exercise, stretch, music. But basically, it's important to stay balanced, not to be perfectionistic, to learn from their mistakes, and to move in baby steps in enough time to work on what they need to work on. Let's talk about bullying briefly, because this is a big issue in this adolescent age as well. Bullying is on purpose. If I can stress anything, it is that. It is not something that has happened on accident, And it's when a child is repeatedly is a key word there, and over time, experiencing the negative actions of one person or a group of people on another person. Usually there's an imbalance of power. One kid is larger than the other kid. One kid is older than the other kid. One kid is stronger. One kid has better social status, or there's a group of kids against one. It's an intentional, repeated occurrence intended to cause harm. And unfortunately, this happens in churches, it happens in schools, it happens in social. There is no immunity because you're in a specific place, okay? There's also physical bullying. That's self-explanatory. There's verbal bullying, insulting, mocking, calling people names, making racist or sexist jokes. There's psychological bullying, where you talk about people behind their back or taunt them or have a relationship that causes harm, making them not feel loved or accepted. And then, unfortunately, probably the worst or more serious is cyberbullying, because it can include all of these and can happen at all hours of the day, on weekends, on holidays, through your phone at 3 a.m. It does not matter. So cyberbullying needs to be focused as a focus as well. The problem is about 25% of kids don't report it. They're afraid they're going to be retaliated against. It won't stop. They themselves will get in trouble. They'll have internet restrictions from their parents, or they think it'll stop on its own, or they feel a sense of shame. But a good percentage of kids do report it, and that is important to recognize and acknowledge. So there's three kinds of people in a bullying situation. There's the bully, there's the person being targeted, and then there's the bystanders who are watching this happening and not knowing what to do. The bully intends harm. It is not an accident. It is on purpose. Their purpose is to intimidate or to frighten or to gain power over this person that appears to be weaker. They may have been targets of bullying themselves, and now they're turning it onto others. So be aware of that. You also have the target. A lot of times people like to victim blame and say, you're the problem, you're the reason that this is happening. Do not blame the victim. They can be boys or girls. Sometimes we think it's not boys because boys are, physically stronger or whatever. But a person who's bullied may feel sad, rejected, alone. They may feel like they have less friends. You may notice that they start to avoid certain places, even church, because they're being bullied. So be careful with that. And again, help them where you can and discuss this thoroughly. Then you have the bystander who is afraid that the bully can harm them, so they don't do anything. They're afraid that they'll be called a tattletale. They're afraid to go tell an adult because they may lose their sense of power in the situation. So be aware of what's going through the mind of the bystander as well. And if they do report the bullying, they should be commended for that, definitely. You may notice some behaviors as a result of bullying. They may skip school or church. They may start receiving poor grades. They may have mental health problems. They may have substance use issues. They can become bullies themselves. And for the bully, in the states at least, many states have legal consequences for bullies that as a result of taunting other people or harassing them as a result of bullying. So your job, if there's a bully, is to help them to not judge others, to promote a place of safety and tolerance, and to positively parent the bully, the target, and the bystander. Tell them to follow the golden rule. Tell them to learn about a person who is different from them. Help them to respect others, and tell them not to put other people down, and to instead discuss feelings of inferiority or whatever they may be feeling that is causing them to do this with their parents or with other people. For the person who is bullied, again, tell them not to blame themselves, tell them to ask for help, remain supportive of them, and tell them to not face the problem alone. Most importantly, they should let it in one ear and out the other, and not let that seep in and soak into their personality or soak into who they are. Again, it's important to tell them that they're not alone and they did not cause this, and not to victim blame, of course. And for the bystander, this is a big responsibility. If you see somebody being hurt, you need to tell them. It has benefits. It will help the bully to stop. If they're afraid, there's verses that can help you with that. But even if you think you're just one person, standing up against the bully and telling the appropriate people will create change in this situation and prevent this bully from continuing to harass and affect other people. There's also mental health concerns at this age. people can become, any one of these mental disorders can affect adolescents and children. Again, it's not a sign of weakness. They can't just snap out of it, but it's anytime there is psychological functioning impairment or behavioral impairment that prevents them from functioning the way they normally would. So for depression, for example, they may be really sad. They may have difficulty concentrating. They may have issues with decreased appetite or sleep, or increased appetite or sleep. They may feel sluggish or hopeless. They can't focus. They're fatigued all the time. They may have anxiety as well. And there's a lot of overlap between depression and anxiety, but depression is more about sadness that they cannot shake. Everybody gets sad, but again, this is affecting functioning. And anxiety is all about an excessive fear that they cannot find what they're afraid of, or cannot pinpoint it, but they're constantly anxious and nervous about everything. This may affect their physical health, feeling high heart rate or sweating, and they may feel powerless in those situations. Anxiety can occur in kids as young as 6, and I have seen kids as young as 6 with anxiety, and only about 18% of kids are receiving treatment for anxiety. But a lot of kids from 13 to 18 and up have anxiety, and it's okay, it's treatable. We just need to address it. There's different kinds of anxiety. Some are physical symptoms, some are about a specific thing, some about general things, some are about being in social situations, and some are related to trauma. Again, these things need to be treated by a professional who can help them to manage their symptoms and fix them from a psychological, biological, and social perspective. In order to treat these kids, we need to sometimes use medications, which is also okay. That regulates the chemicals that are in the brain that may be contributing to this. They need to change their lifestyle, maybe move to a different place, away from bullies or things like that. They may have to change their eating habits and their sleeping habits. They may also need therapy. And of course, they need lots and lots of social support and a community and a village around them to help them to deal with these issues. Then, of course, there is peer pressure. That's something that they deal with. Influence can occur even without their realization. And again, the pressure is to think in a manner that is similar to a dominant person or group because they want to fit in. This may be the influence of a person or a group, but it may happen with or without their realization. So that's really, really important to pay attention to. And I listed this verse here about not partaking with people just because they may be more powerful than you. About 39% of students have been feeling pressured. 39% of students have pressured others and have been pressured themselves. And then 7% of students have pressured other people. So still a significant amount of people have felt or have given peer pressure to others. And we saw the first signs of this in an experiment in 1951, over 70 years ago now, where a person was shown this card on the left with this line. And he was in a group of people, and the group of people were in on the experiment and were told to purposely lie about which one matched on the right. And so the people that were in on the experiment that were told to purposely lie said something like, the line on the left matches C, or the line on the left matches B, when we know it matches A. And so the person that is in the study does not know what is happening, conforms to what the group is saying simply because they want to fit in. So even though they know C is wrong and B is wrong, they conformed and said, nope, it is B or it is C because they want to fit in with the crowd. And this was studied with adults, so even more so with adolescents, that they will do whatever it takes to conform to not appear like the odd person out. Peer pressure happens because they want to think that they're powerful by the person that is influencing you. They want to think that they're powerful. It's not because they want to be your friend. So it's important that you tell your adolescent that they don't want to be your friend. They just want to have power over you. So think about things like, is this person in the same values as me? Do real friends push me to do something I don't want to do? Will this hurt me in some way? Do they have similar values? Use these questions to help your adolescent to determine, is this something I should do or not do based on this peer pressure? They usually will fall under peer pressure for things like substances, fashion choices, the pressure to be in an opposite sex or same-sex relationship even, the pressure of what to do once you're in that relationship, the choices of friends they should have, You should obviously fail this test, because why do you want to appear smart? That's not cool to be smart. So purposely to fail an exam or an assignment, or to attend a party or an event or a function that you do not want them to attend. So these are all usually the themes of peer pressure. Peer pressure can be direct. Hey, let's go to this party together. I think it'll be a lot of fun, where they may feel threatened or pressured. It may be indirect, where you will be outside of this group if you don't comply. Otherwise, the pressure may come from you yourself. If I don't do this, then I will lose these friends. I will lose this school. I will separate myself from these people, and that will not be fun either. You want to prepare them by telling them the potential consequences, not scare them. Consequences are like a domino effect. They can be far reaching, especially on social media. Once they post something, it can go on and on forever and ever. It does not necessarily stop. And consequences are often much bigger than the pleasure that they may get from doing this thing that they thought it would be fun to do. So these are, again, our questions that they can ask. What are the consequences? Is this going to harm me? Is this against the law? Is this against my values? What will my parents and family think? Et cetera, et cetera. And ways to overcome peer pressure is have a buddy system. Don't feel a sense of shame. Speak up for what you believe in. Know what's right or wrong, and it's okay to stand up for what's right or wrong. And choose your friends wisely. That's really where it starts. If you have friends that have similar values, they're not going to push you to do things you shouldn't be doing. This is from a book about how to get teens to succeed. I'm not going to read all 25 of these, but the book is What Teens Need to Succeed by Peter Benson. And it's all about overcoming peer pressure in these 25 potential ways. Relationships are another issue, obviously, because they're starting to separate from their peers, from their parents, and connecting to their peers. They're also exiting one school and starting another. They may be entering the job force, thinking about relationships, thinking about establishing their own life and household. So there's a lot of stuff that's happening socially as well. There's a youth culture, again, where they're shifting from their parents to their peers. They're breaking off into smaller groups. There's less and less adult supervision, and they may have similar attitudes with their peers, and they think their peers understand them, therefore, more than their parents. However, from their parents and families, this is a good place to develop healthy identity, healthy autonomy, healthy achievement, psychological growth, and values. So just because they're starting to connect more with peers does not mean that they should neglect their families completely. Again, they're putting on different masks at this age, and they see themselves in a certain way privately in their own head. This is what they see themselves as, versus how they think society sees them, versus how people actually see them, versus what their ultimate goal is in their own self. So they're constantly putting on these different masks to meet the needs of these four views of themselves, between what they think of themselves, what others think, and what their ideal goal is. Friendships are healthy friendships if they're sacrificial, if they're unconditional in their love. They can trust each other completely. They're accountable to each other. They're loyal. They forgive. They share in joys and sorrows, and they edify each other and help each other to grow. We talked about being equally yoked in our relationships from 2 Corinthians, right? This is not the yolk of an egg. It means to be connected to people in a balanced way. So this is a term that comes from this bar that they put across oxen, used in farming equipment, so that both oxen are carrying the weight equally. So when we're equally yoked, we are in communion with that person. We are connected. They share the same values. They're carrying the weight equally, like iron sharpening iron. So there should be self-control with this peer pressure with relationships. Relationships have to be balanced and calm. In your self-control, you need to be determined to stay true to your values, be confident in those values, and have the willpower and self-empowerment to overcome peer pressure and negative relationships. You have to listen to their perspective as their parents. You have to remember that you're not alone. Again, you're doing this as a group. Understand God's will for your life and their life. You have to listen when they reveal something to you to understand their perspective and where they're coming from. And we'll talk much more about this slide next time with the parenting styles. but they have to know their own self-worth. When they enter relationships, they don't just throw themselves at that relationship, to slowly enter into relationships so that you can see, are your values being honored? Do they have similar values? Do they encourage you and support you, and can you trust them? So you have to have open lines of communications with your kids. In order to overcome peer pressure and to have good relationships, they need to have a lot of good self-knowledge about who they are and to feel empowered in that process. And of course, kids want to fit in. So do adults. People in general want to fit in. But sometimes rejection happens. And truly, that is unfortunate. It may hurt. But this is not a reflection of who they are. And even if they made a mistake, again, our goal is to learn from it. So process the negative feelings, guide them through that process, problem solve with them, help them to work hard in the next situation, but be patient. We are all unfolding and growing and learning as we grow, and help them to build good self-esteem when they're feeling down. Cyber addictions is another big issue. Obviously, computers, phones, we hold a very powerful and sometimes dangerous tool in the phones right in our hands. Cyber addictions can be seen because of a loss of sense of time. You could lose hours on social media. If they are bored with regular activities, if there's a decline in their hygiene, their appetite, their sleep, if they're having physical pains, headaches and neck pains, you can tell this person is cyberly addicted. Put limits on it, parents. Put limits, even if they're teenagers, you're going to get some pushback, but put limits on there. And just like any other drug, they're going to get a dopamine hit that tells them to do this more and more, which will build more and more tolerance, which will get them to do it more for the same effect, the more they use it. So this is just like any other drug, and we have to be careful because of the images they're seeing, because of the social media that's only presenting a negative highlight, negative or a highlight reel of somebody's life. So be aware of what's happening with cyber addictions. Seek assistance from a mental health professional and your village. Help them to engage in other healthy activities, enroll them in a gym, or take a walk with them, or go have a picnic. But do something healthy so it's not just them on the phone or their devices all the time. Anticipate when they might need some help. Ask them non-threatening questions, advise them in a non-threatening way, assist them, and then arrange for a follow-up when you're all done. Help them in every step of the way, and then process it after you're done and figure out what you can do to improve the situation. It is important to communicate, and again, this is something we'll talk about more next time, but it helps you to uncover negative hidden feelings when you listen. It takes away the fear of the situation. Sometimes fear builds up. When you talk about it, the fear goes away. It helps them to hear their own problems and find ways to solve it. And it helps you to learn more about your adolescent. The problem with parents is they're super, super busy. So they either drift off as they're listening, or they only listen for the obvious, the problem. They're not listening to understand. They're listening to look for where the mistake is. And then, of course, the kids are going to shut down, and they're not going to come back to you with any problems. The more you judge, the more they run in the opposite direction. Advice falls on deaf ears because you're only focused on your needs, not your kids' needs. The advice may make them feel worse. You tell them to stop being friends with these people. That's going to be very costly. So you have to show them why it's not good to be friends with certain people, not to just say you're going to stop being friends and that's it. Explain. The advice may not be timed correctly. They may not be willing to listen yet. So be careful with how you are discussing with your kids, and also don't shout with them through a megaphone. That's going to turn them off as well. So be non-judgmental, tell them and show them that you care, explain, explain, explain. And both parents, and sometimes the servants and the priest, all have to be on the same page. Tell them that no matter what, you're not going to abandon them. You're going to be there for them. This is what I meant by unconditional love in the beginning, that no matter what the struggle is or the challenge, you're going to be there and you're going to help them through it, even when they disappoint you. It's okay to be disappointed, but not okay to turn off your love. Be a role model. This is self-explanatory, obviously. Help them to stop and think, be a good role model, show them the right way to do things. And then the ultimate point is to realize you are a parent throughout your life and their life. They're going to grow, so you have to grow. They're going to change and evolve. You're going to change and evolve. What is an adult child to you? Its adolescence has been prolonged until age 10 or 15, beyond 10 or 15, I mean, up to age 26, but they're growing cognitively, psychologically, socially, spiritually, mentally. Ask yourself, have I done a good job? Where can I still be a parent? But now I'm going to guide them, not micromanage their every piece of their life. When do I help? When do I back away? And if there's conflict, how do I resolve it? Again, kids, as they get older, they need more and more and more independence. And once they're adults, you're guiding them by experience, but you're not micromanaging their life as you did when they were 5 years old. So love and support is going to be the main key. Know yourself and your limits. Be empathetic, be consistent. You need to adapt as your child ages, and listen, listen, listen before you do anything else. And that'll help your relationship immensely. Your job as a parent is to go from striving, carrying the weight of the world on your shoulders, to being more resilient, which we'll talk about next time. And it's also your job to know your parenting style, which we'll talk about next time. And it's your job to know how to help your child to be resilient at all stages. That is also for next time. So I know I went over my 45 minutes, but it's important to know that we can't overcome faith. We can't overcome with faith and with the power of our mind, which we'll talk about next time. Thank you.
Fantastic. Thank you so much, Dr. Christine. That was so helpful. And I'm sure, like many others, I'll listen to that presentation again. And it will be recorded, and many other people will be able to benefit from it. I'd want every child of adolescent children in my own circle of churches to listen to that presentation and learn from it.
Thank you.
We have the opportunity for some questions if you want to use the chat to ask them. I do have one question, first of all, that someone asked me in the week, and it relates rather to last week's presentation. That particular age group, probably, although it has application in this age group as well. What can we do to help a child who is very, very shy, a child who is unable to really interact with people in a social setting, such that it becomes something of an obstacle for them? Are there resources you can recommend? What could we do? What could we read? How could we learn to help them in those circumstances?
Yeah, excellent question. People can be shy at all ages, but research tells us that people are not shy in every situation. So if they're in a situation where they are feeling a strength in that situation, they're not going to be shy. So it's really good to have maybe a one-on-one role model. Here in the States, we have like a big brother, big sister type of program that they can do for children, even in schools. Not necessarily talking about churches, but in schools, we have big brother, big sister programs. So if there's somebody older than them that can mentor them and kind of walk them through certain things, more one-on-one time will definitely help as much as that is possible. But the most important thing is to tap into whatever their strengths are. So in my next presentation on resilience, there's a high connection with strengths and resilience. And there are 24 character strengths that we all carry within us, inside of us, on different levels from 1 to 24. We all have all 24, but my number 1 may not be the same as your number 1. So focusing in and leaning more on those strengths can help that person to come out of their shell more, help them to be more confident, more self-esteem. So between good mentorship and learning what their strengths are and leaning on those, you can definitely get kids that are less shy and come out of their shell a little bit more.
Fantastic. Thank you so much. That will be helpful.
Yeah.
Someone else has posted a question. What are your views on the explosion of pathologizing childhood behavior, like the increasing diagnosis of learning issues or disorders such as ADHD, etc.? That's a good question.
Yeah, so some of those things are chemically based, and now we know how to diagnose them better. So the prevalence of these things, especially kids on the spectrum and kids with ADHD, those sometimes go hand in hand. But it's probably because we can diagnose it. We can diagnose it better. We know what to look for better. With things like ADHD, for example, it has to be diagnosed by a professional psychiatrist, a psychologist, and they are looking for things across the board. So it's not just that I'm unable to focus in math class. it may be because I don't like math. So maybe you have one of those other intelligences that we talked about. It has to be across board where they are hyperactive, impulsive, and unable to sit still, those things. So hyperactive, impulsive, and unable to focus. But it has to be across board. So I can't focus when I'm watching a movie with my friends, and I can't focus at church, and I can't focus at home, and I can't. And again, it has to be diagnosed by a professional who usually will interview, their teachers, their parents, and the kids themselves, and look for similarities across their responses across board. So sometimes it's diagnosed frequently, yes, but other times it should be diagnosed only by a professional, but it's usually because we are able to find the features of that much more strictly than we could in the past.
Let me follow on from that myself. And I would want to ask, is it also a case that our much more complicated society, with the much more complicated parenting that is required, also makes these problems much more prevalent? I'm thinking that even though some of these conditions are universal in different ages and places, if you are working on a farm in a rural village 500 years ago, things were a lot easier to cope with. But when everything is changing and demanding all the time, so is our present contemporary Western society and all the stresses that it puts on us as parents, is this also adding to the prevalence or the manifestation of these conditions, do you think?
Yeah, and we can see things from MRIs and different studies about what these devices are doing to our brains and how they prevent us from sleeping at night. And all of these things contribute to focus issues as well. And so it's almost like being in these devices and the bombardment of things all around us affects how we think, sure, for sure. And the phones definitely put people into like a trance-like state, which doesn't let us to focus on normal writing and reading and things like that. So it contributes for sure, along with our ability to diagnose it better than we did, a few decades ago. We teach from a psychological perspective ways to focus better, to shut these things out, to put them in another room for a time. And then from a psychiatric aspect, people can give medications as well to help the brain chemistry to focus better.
So the quality of our lives, is really important, isn't it? A lot of the things that you were speaking about this week and last week about having balance in our lives,
Yes.
this isn't just an optional extra that would be quite nice.
Mhm.
It's necessary for us to have space in our minds and in our lives.
Yes.
It's necessary for us to have exercise, to walk outside. All of
Yes.
these things are a necessary aspect of living well in even in the complicated world we have. And so, as a priest, they are part of the pastoral responsibility I have to encourage wellness among my congregations. Yes, is that fair?
Absolutely. We are biological, psychological, social, and spiritual beings. We have to balance all of those. I'll talk a lot more about that balance in the next session with resilience. But yes, the more that we balance all four of those, the healthier we will be.
Yes.
Absolutely.
I have another question here. About, I guess it's about the problems of moving between different cultures in the age of adolescence. I have in my own churches. Some have come to this country as a very small child, but others have come just at the beginning of their teenage years. What's the consequences and the difficulties around that sort of a culture change in the middle or at the beginning of adolescence, do you think?
Yeah, it can be quite challenging because this is already a tumultuous age period with the biological changes and hormonal and psychological. And so trying to navigate two different cultures is definitely challenging. But again, we can be resilient beings if we are focused on our strengths, if we are connected to a community in this new place so that we're not alone, and they can kind of shepherd us along as we're learning the skills of the new country. Those things can definitely help. If you're moving, I mean, when my dad moved to the US in the 60s, he was all by himself. And, that was definitely very challenging, and churches were much smaller than they are today. He was able to maneuver that and find work, and went very high in his career as a CPA. But it's important to connect to things of meaning and of purpose. and again, a community, so that you're not all alone. It can be challenging, but you can also be resilient. So don't do it alone, is the advice.
No, no.
Yeah.
Anyone else got a final comment or question you'd like to make? Type it now. Then I'll thank you again, Dr. Christine, and we're having our hour together. We'll save this recording and make it available on the internet very shortly. I'm going to put all of these in a particular location as resources for mental health, parenting, marriage, resilience. All of these things go together. Let me thank Dr. Christine on your behalf. And let me turn off the recording now.